Sinus infection could be linked to mental health.
But tonight, some rather shocking news about sinus infections that have the potential to kill children.
Bacteria can rapidly spread back to your brain.
Increased risk of developing a long-running sinus infection.
Sinus, a small word, but a condition that can shake the very peace of life. Sinuses are tiny air-filled cavities inside our skull, designed to keep our breathing light, our voice clear, and our body balanced. But when these passages get blocked, every breath becomes a battle. It's not just a blocked nose, it's a chronic struggle that leads to headaches, sleepless nights, constant fatigue, and even emotional breakdowns.
See, this young 26-year-old lady came to the outpatient department mainly with the complaints of nose blocks for more than 4 years, and she has been having on and off runny nose, which is thickish in secretions, and there was also a postnasal drip. And she also complains of a little foul smell that comes from the mouth and on and off headaches. And for the past 3 months, this problem has increased, and in spite of medication, she was not getting relief. So a CT scan was advised, and in a CT scan, what was seen was her central bone, the septum, was deviated to the left, and there, what we call it as swellings in the nose called turbinates, were enlarged.
If you observe, her central septum is deviated to the left side. As you go back, right up to the back, and there is even a spur over here. And the swellings in the nose called inferior turbinates are grossly enlarged.
And we have rooms around the nose called sinuses, 2 rooms in the cheek, 2 rooms in the forehead, 2 rooms in the inner side, multiple rooms in the inner side of the eye, and 2 rooms present behind the nose. The rooms on the inner side of the eye were affected. They were hazy, and there was a lot of edematous tissue on our examination we have seen. So we had advised this lady a septal correction, correcting a crooked nose bone, 2, a partly reduction of her enlarged turbinates or mass in the nose, and 3, we wanted to open up these sinuses called ethmoid sinus and take out all the secretions and the polypoid mass present.
With septal correction, we do it for children as young as 5 years old, 6 years old also, where there's a grossly deviated septum, because that prevents them from breathing comfortably through the nose, and they end up becoming mouth breathers. We use radio frequency for making all incision in the nose. The advantage of radio frequency is it is bloodless. The crooked septum is now straightened. So totally straightened septum. Now we do what is called turbinoplasty. They give us what is called hypotensive anesthesia, wherein the blood pressure is maintained at a lower level and the bleeding is minimal, so that you can see clearly and operate. This is the crooked part of the septum that is removed.
So this procedure was done. It's roughly an hour and a quarter procedure. And normally the end results of this procedure would be the patient would be able to breathe beautifully. Nose blocks will disappear. On and off colds will drastically come down to a great extent, even up to an extent of about 80 to 85%. And there would definitely, the foul smell would go away and a reduction in her postnasal drip would be there. Normally the healing time is about 40 to 45 days. At the end of 45 days, these patients are happy. And if at all there are any allergies that are associated with it, we normally tackle them at a later date.